made your plan decision, whether you're going with original Medicare with a Medicare supplement or Medicare Advantage, how do you use the benefits? How do you interact with the healthcare system? It's going to be very similar to what you're used to with traditional health insurance, whether you got it on your own or through an employer. But let's go through the scenarios with each type of coverage. If you go with Medicare, original Medicare with a Medicare supplement and a Part D plan, you're going to have 3 ID cards, or three plans really to have your information at hand. You don't need an ID card to get care, just as long as you have your plan information, like your member number and coverage date, that kind of thing. But 3 ID cards, original Medicare, which is that red, white, and blue one that the government sends you with Part A and Part B on it, your Medicare supplement or Medigap card, and your Part D plan for prescription drugs. When you go to a doctor, you're going to hand them your original Medicare card, your red, white, and blue, and your Medigap card. Before you go to a doctor, say it's probably a new doctor in this situation, make sure they accept Medicare. The vast majority of doctors do, but you need to check. There's the easy way to do it, which is Medicare's provider directory. There's a link here. I'll show you just what the first little bit of it looks like. And get that out of the way. So you'll click doctors and clinicians, most likely, but pick based on what you're looking for. And then enter your zip code and enter the name of your doctor if you want, or it'll just show you who's close to you. All right, so that's what to do the easy way. The best way, I think, is to call the practice and ask them, do you accept original Medicare? And they should be able to tell you. If whoever answers the phone first doesn't know, then ask to speak with the insurance coordinator or billing coordinator, someone who would know that information for sure. So check that, and if they do accept, you can go. The other hurdle would be sometimes they accept Medicare, but they're not accepting new Medicare patients. So if you're going to a new doctor, that might be a little bit of a headache for you. But if you're a current patient and you just happen to roll over to Medicare, you'll be fine. When you hand over your ID cards, like I said, you're going to hand over the original Medicare card and the Medicare supplement or Medigap card. The way Medicare supplement plans work is they pay according to how Medicare pays. So every doctor who accepts original Medicare does accept your Medicare supplement plan. There is no back and forth between the insurance company and the doctor on whether they're in network with that or not. If you're in network with Medicare, the Medicare supplement plan is going to ride the coattails of it and it'll be accepted. And then when you go to a pharmacy, present your Part D plan, or Part D card, and that should be all you need to give them. With Medicare Advantage, this is going to be pretty much just like the other health insurance you have had before. Check the specific plans network, which is going to be on the insurance company's website, much like the Medicare.gov provider lookup would be. But with a Medicare Advantage plan, you got to go to the insurance company's version of this. So that's the easy way. But again, same thing. Always call the practice and have them confirm, because something might have changed between the time you made your plan decision and when the insurance company's directory was last updated and when you need to go for care. So always call. That's the smart thing to do. Yes, it's an extra step, but it's the smart way to go about it. And you're going to take the one ID card from your Medicare Advantage plan. That's going to work for everything. Still keep your red, white, and blue original Medicare card just in case, but actively, you're just going to need that Medicare Advantage card. So that's how you use your coverage. Short and sweet, but it is a curiosity. It is a question I wanted to cover here as kind of a last step of rounding this out.